Good afternoon. My name is Brianna Madison, and I welcome you to my collaboration and leadership video for NHS FPX 4010. In this video, I will reflect on my experience with interdisciplinary collaboration, highlighting both successful and unsuccessful outcomes. I will also discuss how poor collaboration can lead to inefficient management of human and financial resources, supported by relevant literature. Additionally, I will describe the positive impact of collaboration and suggest ways to improve future collaboration to help others. I will draw from my experience as a dialysis nurse and cite 4 scholarly articles to support my strategies. Before I proceed, let me give you a brief background about myself. I have been a nurse for 4 years, starting on a general surgical unit for a year and a half, transitioning to working as a home health nurse for 2 years. After that, I returned to the hospital to work in a medical surgical unit. I am now currently working in a chronic dialysis outpatient clinic for a year now, and I enjoy my work. As a chronic dialysis nurse, I work in a 24-hour clinic where I supervise dialysis technicians and conduct pre- and post-dialysis assessments, administer medications, and check dialysis machine orders and ensure everything is running smoothly. Typically, 2 nurses are present at a clinic to oversee the technicians who take care of cannulating patients, documenting their vitals and activity every 30 minutes, and alerting the nurse of any complications. Recently, I had experience with interdisciplinary collaboration that I like to share. One of my patients came in for treatment with no issues. Their pre-treatment assessment and vitals were all within normal limits. Usually, patients come in with fluid overload and present with symptoms such as shortness of breath, tachycardia, and a weight of 5 liters above their dry weight. However, this patient had none of these symptoms. During the treatment, the dialysis technician noticed that the patient's blood pressure was dropping towards the end of the session. The patient's blood pressure was 69/42, and their heart rate was 55. The technician informed me of this findings 30 minutes before the end of treatment. The patient started experiencing shortness of breath, dizziness, and loss of consciousness. While hypertension is common in dialysis, particularly at the end of treatment, this was an extreme case. Dialysis hypertension occurs during a large volume of blood. Water and solutes are removed over a short time, overwhelming standard compensatory mechanisms. This includes plasma refilling and reduces venous capacity due to reduced pressure transmission to veins. All the technicians came to assist me. I immediately laid the patient flat, turned off the ultrafiltration rate, and infused 300 mL of normal saline. The technician provided oxygen to the patient, and the blood pressure improved slightly. I asked the patient to tell me their name, location, and where they are. The patient could not answer any questions, so I infused additional 200 mL of normal saline. So this patient ended up getting a half of a bolus, basically. This brought the blood pressure up to 120/76 with a normal heart rate. The patient was alert and oriented and back to normal. I also took a standard blood pressure to check for orthostatic hypertension, which was within normal limits. As a nurse, I informed the nephrologist of the event, and the physician asked how much weight the patient had gained and how much fluid was removed. I answered the physician questions and suggested that the target weight be adjusted as there was no edema and their lung sounds were clear. The nephrologist agreed in order to adjust the target weight by 1 kilogram, as the patient had probably gained weight, which caused the hypotensive event, because more fluid was taken out than was put in. This event represented interdisciplinary collaboration as the technicians, patients, and physician worked together and communicated effectively. However, I feel that the technician should have alerted me sooner of the blood pressure drop. As I reviewed the previous blood pressure, I noticed that the blood pressure had dropped an hour before I was informed of the findings. If I was alerted immediately, I could have lowered the amount of fluid being removed to prevent the hypotensive event from occurring. Overall, we worked well together to safely care for the patient. As a nurse, I communicated with the physician about the event and suggested adjusting the patient's target weight to prevent this from happening in future dialysis treatments. During the VILA collaboration scenario, interdisciplinary collaboration between corporate, facility management, nursing staff, and IT failed. The significant issue during this scenario was miscommunication between all parties involved. The nursing staff felt unimportant because their voices were not being heard, while the IT department believed that the new EHR system needed a lot of work to be efficiently used by staff. Unfortunately, the company failed to prioritize its employees and decided to take on a cheaper electronic health record, which is EHR system, which impacted the workplace and caused a chaotic environment. Management plays a crucial role in ensuring a safe and open environment for staff. And the VILA health activity, the team experienced a lack of communication. In an article written in 2019 about understanding the impact of interprofessional collaboration on the quality of care, stated, and quote, research has shown that interprofessional collaboration and communication are essential factors that healthcare workers consider when improving clinical effectiveness and job satisfaction, end of quote, by Rosari, article written in 2019. Management could not have taken the initiative to communicate with the staff and provide a platform for their feedback on the change. According to an additional article written by Pounder and Damian, quoted, leaders must have ability to influence, inspire, and empower others to actively participate toward the effectiveness and successful of organization, end of quote. Although management adopted the new EHR system due to cost effectiveness, it ended up costing the company more in revenue due to lack of motivation, implementation, communication, and collaboration. Additional funds were spent on the IT department to learn how to manage and improve the system. A recent study conducted by WHO has highlighted the importance of institutional support and work culture mechanisms, including communication strategies, conflict resolution policies, and shared decision making. Quoted by the author is Whit Sherman, written in 2020. Such mechanisms enable effective collaboration between teams, and the event of conflicts, management can refer to the resolution policies. I believe implementing these practices at VILA Health would address any confusion and concerns. Supportive administrators can play a crucial role in ensuring that these mechanisms are in place. In addition to teamwork, it is a crucial element in collaboration. An article written about teamwork in healthcare, key discoveries enabling safer, high quality care quoted, the quality of teamwork is essential in ensuring the safety and quality of care delivery systems, end of quote. Written by Rosen in 2018. Collaborative teams allow members to leverage each other's strengths and learn from one another. In the villa scenario, for instance, one of the nurses demonstrated proficiency with new EHR system, while others require help. If the efficient nurse could provide support to the others by answering their questions, it would ease the stress on the entire team. In conclusion, for the successful implementation of a new EHR system, it is crucial for management to initiate effective communication and feedback, addressing all concerns received. Prior to launching the new EHR system, proper training of staff is essential, followed by frequent evaluations of the system to keep up with evolving healthcare needs. Quality teamwork and collaboration are key to ensuring the safety and quality of patient care. Overall, I am grateful for the chance to share my insights and contribute to discussion on interdisciplinary and collaboration in healthcare, which has greatly enhanced my understanding of the subject. Thank you so much.